If y'all don't know me, my name is David Anderson, and I have the pleasure of speaking with y'all this afternoon. I'd like to introduce Paula Whitbeck on the back row there. True Methodist, she's sitting on the back row. She is our conference liaison from Westpath, who has been a valuable asset and helped us through a lot of issues with our annual conference, through a lot of issues with pension and health benefits. And we're delighted to have her with us today. And she'll be going around with me the rest of this week as we go around the state. But we're really excited. But the main reason for this meeting today is for you to kind of hear what we're talking about when we talk about our new insurance program that was approved at the annual conference. Our new plan is called the Health Flex Exchange. As I've said before, and you've heard me speak, that we're living now in a real dynamic time when we talk about healthcare and healthcare funding. This market that we're in now is changing almost hour by hour, to be really honest with you. The landscape is changing as we speak. Somebody asked me in Rock Hill if we still had the same federal laws as we had a week ago. I said, well, when I left the office this morning, yes, we did. So I don't know, but there's things happening in Washington every day. So this changing landscape just required our board to look and study and come up with some ideas so we can deal with what's going to happen, what we have now and what may happen in the future. And through a lot of study and a lot of review, we think that the best option for South Carolina and the South Carolina Annual Conference is the Health Flex Exchange through Westpath. I want to first start off by talking to you a little bit about, we're going to talk a new way to think about insurance. A new way to think about insurance. Most people think insurance is just merely your right to health care, but that's not what it is. That's not what it is. Insurance is basically a means to manage the financial risk of health care costs. And that's what it's all. There are different ways to manage it. There's different options available, and we're going to talk through several of those tools. Our traditional concept is, the insurance philosophy is the fortunate few pay for the fortunate many pay for the unfortunate few, and that is true, depending on the option. But we're going to talk to you a way that we can manage that financial risk, and some of it with our own resources, some of it with what's the resources available through the plan, and come up with a plan that helps strategically for the annual conference to be able to sustain offering a health benefit for a long time. We feel like that this Health Flex Exchange is the best one, and we're going to go through it today. And I'm going to start off by introducing you. This is the agenda that we're going to go through today. We're going to have the overview, plan choices, defined contribution, health accounts, decision support tools, and how to in your annual election. Now, I want you to expect in our meeting today, leave here with a basic understanding of what the plan options are. You're probably still going to be somewhat confused. That's fine. Don't feel bad if you are. You're going to leave here knowing how to decide which plan is right for you. Leave here with knowing where the resources are to make your decision and what materials you need to gather. Do not expect to leave here with having made your choice for 2018. You still need to do some homework. Do not leave here thinking staff or the CBO will tell you what plan is right for you. Do not leave here thinking everything's going to be crystal clear when you leave. And don't leave here expecting to save hundreds of dollars on health insurance. Okay? Now we're going to go to the short video.
Introducing Health Flex Exchange. a new approach to choosing HealthFlex coverage that gives you more choice, more flexibility, and more control over your costs, while helping the church continue offering health coverage for clergy and lay workers. HealthFlex Exchange is the Center for Health's response to changes occurring across the nation. Many employers are striving to balance health coverage and sustainable costs. As many organizations move more responsibility for healthcare costs from employers to those who use the services, HealthFlex has designed an offering to meet that demand, HealthFlex Exchange. Across the country, most employers now offer less generous health plans than in the past. Many provide creative funding opportunities for employees, such as fixed-cost defined contributions, health reimbursement accounts, and health savings accounts. HealthFlex is also using these features. HealthFlex Exchange is not a public exchange and is not associated with government agencies. HealthFlex Exchange is a group health plan designed for United Methodist Church clergy, affiliated lay employees, and their families. HealthFlex Exchange provides the same high quality you've come to expect from HealthFlex. You will have access to the same network of doctors, hospitals, pharmacies, and other providers you're using now. And you will have more dental and vision options, even if you didn't have dental benefits through HealthFlex before. Plus, you will keep the same wellness programs and incentive opportunities. These are key to the HealthFlex commitment to well-being. What makes HealthFlex Exchange different? This new approach offers flexibility to choose the HealthFlex plan you want from among more plan options. HealthFlex Exchange puts you in control of your plan selection. Choose the plan that best fits your medical needs, budget, and family.
That was a great overview of what we're talking about. And I really wanted, we're going to talk a little bit more about the conceptual framework of this. You know, basically you got more plan options. You have been, I've always, the last few years I've only had two options. That's the CDHP 2000 and our PPO 1000. And now we're going to have 6 medical and pharmacy combinations. You have 3 separate options on dental and 3 options on vision. So there's more choice, and basically you've got the options of plans. Some of them have higher premiums and lower out-of-pockets, and some of them have lower premiums and potential higher out-of-pockets later on. So in this plan, you get to shop for what you want. And we're going to give you, tell you how much the total premiums are. We're going to tell you what the defined contribution that the conference is offering or the church is offering. And then you get to figure out the net cost and next impact. This guide on this video, on this slide, it shows 2 different, premium being less than defined contribution. We don't have any of those, but we do have a variety of options where the premiums are less higher than the defined contribution than others. Okay, so this is a little bit about, the other thing I want to tell you about is you don't have to worry about the quality. You still have the same quality. Blue Cross Blue Shield of Illinois will still administer our claims. Optimum RX, who does our manages our pharmacy benefit, is still going to do that. And you know, there is one firm you can use if you want to get your prescriptions filled locally. Anybody know what that is? Walgreens. That's good. Okay. I'd like to take credit for that, but I can't because it's not because of anything I did, but you know, a lot of people like it. United Behavioral Health still processes our behavioral health claims, manages that. And the new dental program will be managed by Cigna and through their network, and also our vision program will be managed through our VSP program, and we'll talk more about that later. You still got the same networks, same formulary of Optimum RX. You got still the same award-winning well-being programs. That's our wellness programs. We know a little bit about that. WebMD, the Virgin Pulse, the Quest screenings we do at annual conference, and y'all do every year. Revive Health and more. You still have the Pulse Cash for for your activity and staying active, screening and wellness points, and taking your health quotient will keep you from having a higher deductible. You have more choice. I said before, you got 6 medical pharmacy plan options, 3 dental, and 3 vision. You look at the plans and see which one's best for you. How many covered people do you cover on your plan? Is it yourself, your spouse, or children? What's your financial risk tolerance? And what is your financial preparedness for an emergency situation? Those are the things. And then, but you know, as we said earlier, this is something different. You've only had 2, and I like to say this: clergy, especially clergy. Now, a lot of y'all are not clergy, but I'm just going to talk in general. Our clergy are really are put in a position where they don't have to make a lot of choices that a lot of other vocations have to make. Number one, they don't choose where they're going to work. They're sent. They're told where they're going to work. Secondly, they don't choose where they're going to live, because they're going to live around where they're going to serve, and maybe in a place provided by the church they're going to serve, or in a housing allowances, but they still expect you to live close to where you're serving. The third thing that other vocations do, they get to determine whether they take a job or not at a certain salary. Our clergy don't get to do that. They serve where they're sent, and they're paid what the church says they're going to be paid. And in the past, you've been told, this is a health plan that you got, and learn to live with it. But this is different. We're going to say, you've got to do the research to see which is right for you. And a lot of people say, well, I don't really want to do that, but let me tell you, when you get later in life, these are some tools you're going to need. Because we talked this morning about the predatory nature of the health insurance industry as you approach Medicare. Because as we approach Medicare, when I came close to being 65, my phone voicemail was full every day with robocalls from health insurance companies. And a lot of them represent themselves as Medicare, and they're not. So you've got to learn some skills to get through that, and I think will help you. So we're not going to leave you in a position where you have to make these decisions without looking at anything. Y'all may want to pull out your slide presentation and follow along if you want to. It's in your folder. But we got some tools we're going to offer you in learning how to deal with this. One of them is a thing called, we're going to talk more about it, it's the Alex Benefits Counselor program that's available now. And we'll talk how you access that later. In November, during open enrollment, we're going to have My Choice that you can go on. And that's the Alex Benefits Counselor is really non-insurance jargon. It's pretty straightforward. My Choice is a little more spreadsheet looking. But we've got telephone support that we're going to provide. We're not going to leave you alone to make your decisions. It's not a government exchange, and I really like to emphasize that. It's not a government exchange, because at annual conference when we voted on it, I looked and saw about 5 or 6 people who voted no, and I went up to the first one that I saw after we did our presentation, and I said, just for my benefit, would you tell me really what was the problem with this program that you voted against it? And she said, I don't want my pastor covered under Obamacare. I said, well, at least 10 times in the presentation I had said it's not a government exchange. It's not a government exchange, and this is how it's different. We still got the broad national networks that we had before. Most public exchanges have narrow networks with just very few providers. Our premiums are the same regardless of age, whereas premiums vary in public networks by up to 5 times age. It's not what the church and what the conference puts in and what you put in are not taxable. It's before tax. whereas the public exchange has no pre-tax funding, but if you can qualify for tax credit in certain circumstances, but not everybody. We do have the well-being programs and other incentives, and there are none in the no incentive programs or well-being programs in the public exchange. We're going to talk about the plans that are going to be offered now.
You will have 6 HealthFlex medical plans to choose from. A traditional PPO plan, consumer-driven health plans, each with a health reimbursement account, and qualified high-deductible health plans, each with a health savings account. All HealthFlex plans cover eligible well-person services at 100%, including annual checkups and age-appropriate immunizations and screenings. But there are important differences in how these plans cover other services, like doctor visits, hospital care, and prescriptions. With a PPO, you will pay a fixed co-payment for some services, like office visits, but you must meet the deductible before other services will be paid. With the consumer-driven health plans, you will pay a higher deductible for medical services, and then the plan pays a fixed percentage of costs. However, you won't have a deductible for pharmacy costs under the CDHP. And with the high deductible health plans, the plan also pays a fixed percentage of costs, but your deductible includes both medical and pharmacy expenses. If you have covered dependents in one of the HealthFlex high deductible health plans, you will need to meet the full family deductible before the plan begins paying a percentage of any expenses. Each HealthFlex medical plan option is paired with a specific pharmacy plan. There's another way to look at HealthFlex plans. Like plans across the U.S., your HealthFlex plan options are now grouped into metal levels, commonly called gold, silver, or bronze. Gold plans generally have higher monthly premiums, but lower out-of-pocket costs for services like doctor visits, prescription costs, or hospital stays. Gold plans cover about 80% of eligible costs on average, and you pay about 20%. Silver plans generally have lower monthly premiums, but higher deductible costs and higher out-of-pocket costs for services. Silver plans cover about 70% of costs on average, and you pay about 30%. And bronze plans usually have the lowest monthly premiums, but higher deductibles and higher out-of-pocket costs for services. Bronze plans cover about 60% of costs, and you pay about 40%.
Well, there are a few terms you may need to know. I'll go over a couple of them. The CDHP, that's a consumer-driven health plan. That's one of the terms you're going to need to understand. HDHP, that's the high deductible health plan. That's is an IRS qualified where you're qualified to have a health savings account contribution. Your PPO is a preferred provider organization. A few terms that you might want to know is out-of-pocket expenses. The co-insurance, that's the amount the plan or you pays. If you meet the deductible, it pays at 80%, you pay at 20% of the network amount. Co-payment is a fixed dollar amount you pay at a point of service, and the plan pays 100%. That's like at a doctor's office on the PPO. It's $30 for a primary care physician and a few others. Out-of-pocket maximum, that's the maximum you can pay for covered medical, pharmacy, and behavioral health expenses per year before the plan would start paying. And that's something, the major ways that differs in the different plans. And there's a alphabet soup of accounts. That's all I can say. Health reimbursement account, we'll talk about that more later. Health savings account, we'll talk about that more later. There's a flexible spending account, and that's included in every plan, and we'll talk more about those later. And then there's a defined contribution, which we'll talk in depth about later. There are two ways to think about your plan. You can think about it in the type of plan it is. There's a preferred provider organization. And that's usually where you pay a co-payment for certain services. And then once you reach your deductible, the plan pays a co-insurance. And then there's the CDHP, which is consumer-driven health plan, and that is where once you reach your deductible, the plan starts paying at a certain percentage, and usually the CDHP is associated with a health reimbursement account, and then to offset some of your deductible. And your HDHP is the high deductible health plan, and it's a little bit like the CDHP, but you have to meet your deductible, and there's certain differences, and we'll go over those in a few minutes. And then the second way to look at it is how generous your plan is. Is it a gold level plan, which you pay on an average of 80%? Is it a silver level plan at 70%? Or is it a bronze plan at 60%? The silver and bronze plans pay less, but they cost less in premium dollars also. Let's talk about the different types of plan briefly. PPO, I think I covered that. You fix copayment for office visit, urgent care, ER, and then the plan pays 100%. Other medical services, the deductible is met, and then the plan pays a fixed percentage, and there's no deductible on your pharmacy cost. The primary care copayment is usually $30. I think there's several of physical therapy, occupational therapy, speech therapy, and chiropractic is a $30 copay also. Specialist is a $50 copay. Urgent care is a $100 copay. And the emergency room is a $200 copay. And after those, you do that. Now, your copays do not count towards your deductible. But once you meet your deductible, the plan pays at a fixed percentage. For our PPO plan, it pays at 80%, and you pay 20%. And you don't have to meet the deductible for the pharmacy plan. There are two different CDHP plans. One's the C2000, which is a gold plan, and the C3000, which is a silver plan. They require you to, like I say, to pay the deductible first for any medical and behavioral health expenses, and then you pay your share. And for the C2000, you pay 20%, the plan pays 80%. And for the C3000, you pay 50%, and the plan pays 50%. Like the PPO, you don't have to meet a deductible to kick in for pharmacy costs. And the one thing special about our CDHP plan, they include HRA funding, health reimbursement account funding. That health reimbursement account for single on the C2000 is $1,000 per year, and for a family it's $2,000. If you cover anyone besides yourself, participant plus one or participant plus family, you're counted in the family HRA. Now, in the C3000, singles are $250 provided through your premium, and $500 for the family. Okay, let's talk about the high deductible health plan. Let me before we get in that, let me just say, high deductible health plan is not a real new concept. In the 90s, the state of South Carolina offered a high deductible health plan. Paula probably remembers me bringing it up in our CBO meetings, saying, why can't we do something like this? And I will claim credit for that. But because I knew that the IRS had set these qualified plans up. We had done it with the state when I was there. However, we did not educate our employees very well, and they really didn't do very well. A lot of people signed up for them because the premiums were up, but they didn't go back and set up the health savings account. And you'll see the folly of that, hopefully, as we go through our discussions today. All right, this HDHP, you have to meet your deductible, no co-payments. We have a combined medical and pharmacy deductible. You have to meet the deductible before pharmacy is paid. And if you're family coverage, the full family deductible has to be met before the plan starts to pay. All right, some of the unique features, I just covered two of the unique features. That you got to meet your deductible before the discounted cost, before your plan pays for your drugs. The full family deductible has to be met. And then each one of these plans has a health savings account associated with it. The H1500 has a $750 for single coverage health savings account, of $1,500 included for full family. And you can still contribute up to the IRS maximum in that to fulfill that IRS, and we'll talk about that a little later. In the H2000, there's a $500 for single, $1,000 for family coverage. You can still contribute. And the H3000 HSA is personal contribution to the HSA only. Now, I'm going to say this right off the bat. The first time I did this, I had somebody say, well, you know, the HSA is, you know, hand you a pistol and shoot me with a gun if you choose that option, but not necessarily so. One of our colleagues who is at Westpath, she's a young mother, married, got 2 children. Her oldest child has a congenital heart defect. She chose the bronze plan. She put she saved from the most expensive plan to that into a health savings account. She put a medical reimbursement account. And her child, pharmacy, family deductible, went up, met at family deductible, ended up having to have surgery in the first 3 months of the year, got up and met the out-of-pocket limit. But she had set aside most of that in the HSA and the MRA. And she was able to match the plan pay. The thing of it is, the higher your deductible and the higher your percentage of copayment, the quicker you meet the out-of-pocket limit. And there's only $3,000 difference between we're going to show you in a minute, between the lowest out-of-pocket limit and the highest out-of-pocket limit. I'm going to give you some service examples. Go to the doctor, the PPO pays, you pay a $30 copay. Somebody asked me what PT was on this slide in an earlier session, I blanked, but that's physical therapy. Psychologist is $30 copay. In the CDHP, you have to meet your deductible. You pay the full discounted cost and then once you met your deductible, the plan pays whatever percentage the plan is called for. Same with the high deductible health plan. In your inpatient, outpatient care, that's the way it is always in PPO plan. You pay the deductible, then the plan pays at whatever coinsurance rate, and you pay the balance of the negotiated rate. Same on the CDHP, same on the HDHP. Your medications, there is no deductible on the PPO and the CDHP. The generics is a $15 copay for 30 days, $35 for 90 days. 20% of discounted rate, for the $55 maximum, and you 25% that. And generics on the ADHP, you pay the full discounted cost until you meet your deductible, and then it's the same reimbursement as the CDHP. Well, you do have in your tools a cost estimator on your WebMD. Let's go to the left corner of the, and I'll show you in a little later, I'll show you where it is on the website. I want to tell you a little bit about the medal levels. Your gold medals plans are your B1000, which is our PPO, our C2000, which is a CDHP, and our H1500, which is the high deductible plan. They have higher premiums, but it's lower deductibles and lower out-of-pocket costs. On the silver levels, we got C3000, C2000, it's lower premiums and higher deductibles and out-of-pocket. They average 70% pays out. And then there's the bronze plan, your H3000, which is 60%, and you pay out 40%. Once again, you hit the out-of-pocket. Once you hit the out-of-pocket, it pays 100%, so the 60% is on the average for the population. Just remember that the gold plans aren't necessarily better plans. You pay more up front and less later on. It's just a preference of how you want to pay your cost. This next slide shows you how our plans are grouped. The B1000, C2000, and the H1500 are gold. Silver is the H3000 and the H2000. And of course our bronze is the H3000. Also included in all our plans are those wellness services. We don't have a plan that singles out just medical. All of our plans give the full array of medical, pharmacy, and behavioral health. And the out-of-pocket maximum includes deductibles, co-payments, co-insurance from medical, behavioral health, and pharmacy. Now remember, in all our plans, inpatient and outpatient services require the deductible to be paid, and then the plan pays co-insurance and you pay the other part of it. There are no lifetime maximums on any of our plans. And we have a comprehensive well-being programs and incentives on the plans. Our next slide talks a little bit about our medical and behavioral health plans. It talks to you, again, we're talking about the co-payments, medical, urgent care, emergency room, and generic prescriptions. The CDHP has co-payments only on generic prescriptions. The HDHP is only for generic prescriptions for the H1500 and H2000 after you meet the deductible. When your deductible applies, it's got to meet before your health and behavioral health services other than those in the first block. And any of them must be met before the plan pays anything on the CDHPs. HDHP must be met before the plan pays anything and prescription drugs. And if you're family deductible, if you're family coverage, you got to meet your full family deductible before any claims will be paid. And you have separate deductibles on the PPO and the CDHP. Okay, the next slide I want to talk a little bit about is our health accounts. Your PPO does not include any health accounts. You are eligible for your your medical reimbursement account under the flexible spending account arrangement. Your out-of-pocket maximum on all three are the same. It's going to include all your medical, behavioral, and health and pharmacy. Your CDHP includes the HRA. You're eligible for full use of health care medical reimbursement under the flexible spending accounts. Your high deductible health plan, you're eligible for your HSA, and you're eligible for a limited use medical reimbursement account, and I'll talk to you a little bit more about that in just a little bit. Our gold plans at a glance, this is gives you almost everything. Your deductibles, you'll see the B1000 is a $1,000 individual, $2,000 family. Your CDHP C2000 has a $2,000 individual deductible, $4,000 for the family. Your H1500 is $1,500 for individual, $3,000 for the family, or if any other dependents are covered. There's your office visits, $30 copay. You got to meet the deductible on the CDHP and the H1500. Your other medical, those are the same, 80%, 80%. And the drugs, the PPO has a slightly richer drug plan than the other two. Your health account funding for your gold CDHP has the $1,000, $2,000 I mentioned earlier. The H1500 has $750 and $1,500. And your out-of-pocket maximum you see is $5,000 for individual. Family is $10,000. For your single is $6,000, and your family is $12,000. And your single is $6,000, your family is $12,000. That's kind of our gold plans at a glance. You can kind of look at. Silver plans, your deductible on the C3000 is $3,000, $6,000 for family. The H2000 silver plan is $2,000, $4,000 for family, or if any dependents are covered. Your office visits you meet the deductible and they pay 50%, whereas in the H2000 you meet the deductible, the plan pays 70% on office visits. Same with medical service. The CDHP C3000 $3,000 pays 50%, and the plan pays 70% on the H2000. And your preferred drugs, you don't have to meet the deductible, but it's 25% co-insurance. Whereas you do have to meet the deductible on the H2000, and it's 25% co-insurance. And plan sponsor funding, you get a health reimbursement account of $250 and $500 for family. On the silver C3000 for health savings account, you get $500 and $1,000. Your out-of-pocket maximum on those two are singles $6,500 and families $13,000. And then, of course, the bronze H3000. Of course, wellness visits are covered at 100% on all our plans, okay? Y'all need to know. You got a $3,000, $6,000 deductible. Plan pays 40%. Other medical service plan pays 40%. Prescription drugs, you meet your deductible, then the participant pays 60%. And the HSA, your participant, it's your contribution only, and it's still got the $6,500 and $13,000. Well, the one question I expected was why is C3000 a silver plan when they pay 50%? Why would you think? Because it averages 70%, but you see, you don't have to meet your deductible for your pharmacy, and it averages out 70%. All right, these are your in-network highlights. I don't think it's anything we didn't say before. It shows the out-of-pocket maximum for all the plans. We talked about your deductibles for all the plans, and your co-insurance payments for all the plans. Here's your basically, we've gone over this before, I guess it bears. This is what you pay. If you're in the B1000, the PPO, your primary care visit is $30, your specialist visit is $50, your physical therapy, occupational therapy, speech, dietitian, and chiropractic office visits are a $30 copay. Urgent care centers, if you go to urgent care instead of a regular doctor, that's $100 copay. And emergency room visit, the most inefficient place to get health care is emergency room, and that's a $200 copay. Any of the other plans, you have to, you pay after the deductible. 20% for the C2000, 20% for the H1500, C3000 is 50%, and H2000 is you pay 30%, and of course the bronze you pay 60%. Here's the pharmacy detail. It basically, if you'll notice that the gold plan has slightly richer copays. It's 20% for the preferred brand. The copays are $15 pretty well across the board except for the bronze plan. Your preferred, that's where you see the percent after the deductible, that you pay. All right. Any questions on the pharmacy benefit? And this is the 30-day, and there's a 90-day, which kind of expands it. It's $35. I won't bore you by going through each block. You got several key factors you need to think about as you go about making your decision. First of all, your family size. Are you participant plus one? Are you participant plus family? And you got how many? Do you have 4 kids? Do you have 5 kids? Do you have 6 kids? Do you have 1 kid? Excuse me, we don't have kids, we have children, excuse me. How many children you're covering, how many families? That's something to think about. Think about the health status or your anticipated utilization. If you got one person that's going to be a heavy user, it will get you to your deductible and maybe to your out-of-pocket faster. And you got to think about that. Was that person going to use? And so it opens up the other. That's something to think about. What is your financial risk tolerance? Are you okay with writing a check for $1,000? Are you prepared to do that? Financial pay. And another factor to think about is your proximity to Medicare eligibility. And by the way, if you are within a few years of being eligible for Medicare, please see me after. I have a document you need to think about, but we'll talk on that. I'm going to talk about them a little bit individually. Your family size, your high deductible health plan. That's one thing to really consider on the HDHP. If you're on family coverage, the whole family deductible has to be met before the plan starts paying anything. Okay? And that we do have different levels, and we'll talk about this in the defined contribution. For individual and family coverage, we kick in a little bit more towards family coverage than we do for individuals, so you need to factor that in. Your health status, now this next slide, or the little graphic on there you'll see, that's part of your ALEKS program, which is kind of cute to go through sometime. This is what the ALEKS can give you. It can calculate your high expected use, out-of-pocket expenses, and your low. It can tell you which is best for you. In this particular case, you see the second one on the left is calculated as best, and the last one on the right is calculated as best. That's one of the tools we give you, and we're going to talk a little bit more about it later. There's no real best plan for people who have high needs versus people who have low needs, but ALEKS can help you estimate and decide for yourself. I can't say much about the financial risk tolerance and financial preparedness. How comfortable are you with unexpected expenses? We provide with the plans a safety network, and that's through our health accounts, the HRA, the HSA, the healthcare medical reimbursement account through flexible spending. But you also need to have some savings set aside for that too. So it's kind of like home or car insurance we're talking about. The financial risk of this health care is just like the financial risk of whether you want a $5,000 deductible on your house or a $1,000 deductible. My first house, I had a $250. That's how old I am, But I mean, that's unheard of today, But 1,000 is probably the lowest you can get now. But that's the way it works. Let's talk a little bit about the dental choices. I know this is exciting stuff. I can just see it on your face. This is thrilling. I know. First, I'm going to talk about our PPO. The PPO is through Cigna, and that's a dental preferred provider organization. Now, I'm going to tell you up front that Cigna does not have a huge network of dentists in the state of South Carolina. And let me tell you the reason for that. Nobody has a huge network of dentists in the state of South Carolina. I can tell you this, I've been trying to negotiate networks with dentists since 1989. When I ran the state health plan for 13 years, I failed every year to get them to agree to a network. But Cigna is one of three I think we got in the state. MetLife is another, and Delta Dental is the third one, I think. But Delta Dental is probably the biggest, but they pay less than anybody else. But we have some. You can go on this. You can dig through this Cigna.com website and find out if your dentist is in the network. It takes a little effort, but you can do it. It takes a little effort. Now, the PPO gives you a $2,000 maximum annual benefit, 90%. For those on the network. All plans that we have cover preventive at 100% of the negotiated rate. If you're in the PPO and you go out of network, you only have a $1,000 maximum annual benefit, and they pay 80% out of the network, and you're subject to be balanced bill. But they have two different options that I've always thought were rather unique. You got the passive PPO 1,000 and a passive PPO 2,000. And those basically work like this. Now there's a deductible. There's a $50, $150 deductible for families. But once you meet your deductible, the passive PPO, now remember all preventive is covered at 100%. You got the passive PPO 1,000, you got a $1,000 maximum benefit annually. They pay 80% after the deductible of negotiated rate. Same co-insurance in and out of network, but out of network you can be balance bill. The passive PPO 2000 has a $2,000 maximum annual benefit. Plan pays 80% after the deductible. Same co-insurance in and out of network, but you can be balance bill again. And all of them have a juvenile orthodontia benefit. That's in you've got all that in your folder. I won't go into that. But there's one feature in these that I think is really neat. If you do your preventive network, if you go for your preventive service, each year, up to 3 years, your maximum benefit will increase $150. So if you get the teeth cleaned twice a year and get your exam, each year your maximum benefit will go up. So you can actually get up to additional $450 just by getting your teeth cleaned, which is covered at 100%. I think that's a really neat feature of this plan. I've never seen a plan with that in it before. So, okay, you do have some vision plan choices that you've never had before. You've always had a vision plan component to your coverage, and that is an exam. We call it an exam only, but basically if you go to a VSP provider, you can get your vision exam for $20. And normally people in the VSP network are not ophthalmologists, they're optometrists, but you can get a vision, and they are good, but you can get $20 an exam. And they give you a discount on your glasses and contacts. But you usually get a discount if you just go to Lens Crafters, Pearl Vision, or Sam's Club, Costco, whatever. But we've got two more options. You can go full service, which you get the same exam benefit, plus you get $150 a year towards glasses or contacts. And then they have the Premier, which is the same exam benefit in network, plus $200 towards glasses or contacts. And those are your three options. You know, your vision and dental needs, the things to think about is who you're covering. Who's your cover? What is their dental or vision? You know whether you need glasses or not. Most people do until the first time. You know if you have contacts, and then everybody needs dental care. We used to have somebody that worked in this building used to come to me and say, do you realize how much unmet dental needs we've got out there in our clergy population? I said, yeah, and as an administrator, that scares the fool out of me, because if we ever offer it, that first year is going to be hang on tight, and it might be. We'll see. What's the financial risk? Are you able to buy a pair of glasses? Maybe if you can handle that, you might want to look just at the vision only. If you can't afford, then you might want to look at getting one of the others. It's that same thing. You're going to pay. You want to pay it in premiums, or you want to pay it when you get the bill. That's sort of what it is. Managing that financial risk. All right, we're going to talk. I'm going to show the video. I've been skipping this one, but I want y'all to see this video on the defined contribution, and then we're going to talk about that and talk about specifically how it impacts South Carolina, our people here in South Carolina.
Although you will choose your HealthFlex plan, the church helps you pay for it. Your annual conference or other UMC employer designates a defined contribution to be used specifically to purchase your HealthFlex plan. Defined contribution is an annual fixed dollar amount that each primary participant receives to apply toward the monthly cost of HealthFlex plan premiums. This is becoming a more common way for employers to help fund health coverage. Your conference or employer decides the specific dollar amount for your defined contribution. The defined contribution will show as a credit toward your purchase when you're selecting a health plan online during annual election or when you first enroll in HealthFlex. Use the defined contribution to help pay for the HealthFlex plan you select. To understand how the defined contribution works, let's compare two pastors in the same annual conference. In this example, the defined contribution is $600 per month or $7,200 per year. Both pastors receive the same defined contribution amount. Through HealthFlex Exchange, Pastor John selects a plan that costs $700 per month for premiums. Because Pastor John's premium costs more than the $600 monthly defined contribution amount, he is responsible for paying the difference. His church will deduct the extra $100 each month from Pastor John's paycheck for his health plan premiums. Pastor Judy, however, selects a plan that costs $500 per month, which is less than the $600 monthly defined contribution amount. In this case, the $100 difference between the monthly premium, $500, and the monthly defined contribution, $600, will be credited each month to Pastor Judy's health reimbursement account or health savings account, depending on which plan she selects. Pastor Judy can use the funds for her deductible, co-pays, or other eligible healthcare expenses. Or she can save the money in her account for future healthcare expenses. Depending on the amount contributed by your plan sponsor, there may or may not be a plan that costs less than your defined contribution.
Okay, first of all, let me start by saying there is no Pastor Judy options in our conference. All of our plans, that's a philosophy that our board has taken, that everybody needs to have some skin in the game to help us keep healthcare costs down. But that defined contribution is really very similar to what we've been doing with what we call blended premiums in the past. This is a slide, and I think I gave you this out as a separate handout, this document right here, and it shows our defined contribution that we give. We bill the churches $966 a month or $11,592 per year as a health benefits fee. That equates a defined contribution at different levels for different people. The participant-only people, that equates to $611 a month defined contribution. For participant plus one, that equates to $1,233 a month per individual defined contribution. And for family coverage, it equates to $1,646 a month defined contribution. And this little chart here, I think, really tells you, the first line on it says premium. That's the total cost for each one of the plans per month. And the second line is the defined contribution. And the third line says net impact. And that's really how much it costs. It's going to have to be taken out of your paycheck per month. And you see, participant only, we go from $304 a month for the B1000 Gold to $71 a month for this H3000 Bronze plan. For participant plus one, $602 down to $132, and almost any amount in between you can see there. And then the family, we go from $865 net to $222 a month. So that's the way we do the defined contribution. Local churches, they determine their defined contribution for lay employees. If they're participating in a plan, they define their lay employees. And our defined contribution is different for our early retirees who are on active plans. We're going to talk about, I describe the exciting world of health care accounts now, which is, we're going to start with the video, and then we'll go over some real interesting slides, I think. But I'm going to move on to talk about our health care accounts.
Most plans available through HealthFlex Exchange include a health reimbursement account or health savings account. Let's look at HRAs and HSAs more closely. Both types of accounts have pre-tax funding contributed by your plan sponsor. Both are intended for eligible healthcare expenses. Both allow balances to roll over and build year after year with no limit on the amount that accrues. And both accounts are compatible with an optional Dependent Care Flexible Spending Account, which you can elect during annual election. Now let's learn about the differences. In HealthFlex Exchange, the Health Reimbursement Account, or HRA, is paired with the consumer-driven health plans, while the Health Savings Account, or HSA, is paired with the qualified high-deductible health plans. For the HealthFlex HRA, only the plan or plan sponsor can make contributions. You cannot add your own money to an HRA. HRAs do not earn interest. If you leave the UMC or waive HealthFlex coverage, you have 90 days to spend any remaining HRA balance. After 90 days, your unspent HRA funds are forfeited. But if you retire, your HRA balance remains usable until the funds are exhausted. With a HealthFlex Exchange HRA, you can also set aside your own pre-tax payroll deductions into a Health Flexible Spending Account, also called a Medical Reimbursement Account, or MRA, during annual election. Then you can use the Flexible Spending Account to pay for eligible medical expenses during the year. The HealthFlex HSA has some important differences from the HRA. For one thing, you have the option to add your own funding to the HSA account. Annual HSA contributions have a dollar limit defined by the IRS, so the plan sponsor's contribution, plus your optional contribution, plus any DC excess, cannot exceed the IRS limit each year. Furthermore, HealthFlex HSAs can earn interest depending on investment options. HRAs don't. If you leave HealthFlex, you take your unspent HSA balance with you, instead of forfeiting the balance after 90 days. Your HSA belongs to you, regardless of your relationship with HealthFlex or the UMC. An important distinction for HSAs is how they work with Health Flexible Spending Accounts. If you choose a HealthFlex high-deductible health plan, which automatically includes a health savings account, you will be restricted to a limited-use Health Flexible Spending Account until you meet the IRS-defined deductible. Limited use means the flexible spending account is only for dental or vision expenses. The same limited use rule applies to any carryover funds you may have from the prior year's Health FSA, including a spouse's Health FSA from another group plan. Limited use also applies to any HRA balance you may have from a prior year, including a spouse's HRA. Keep in mind that the high-deductible health plan gives you the option to make pre-tax contributions into your HSA. For some people, the HSA is a good alternative or addition to the Health Flexible Spending Account because they don't risk forfeiting the unspent HSA balance. If you do have limited-use accounts due to an HSA, you have the option to transition your Health FSA or HRA accounts into full-use accounts after you've met the IRS-defined deductible. Contact WageWorks for more details or to transition your Health FSA or HRA accounts after meeting the IRS-defined deductible. And remember, if you have eligible dependents, you can have a Dependent Care Flexible Spending Account with any HealthFlex plan you choose. The HealthFlex Exchange brochure and handouts have more details about HSAs, HRAs, and FSAs.
I love this next slide. It reminds me of the Three Little Pigs and huff and puff and blow your house down. We do have three different kinds, and these are kind of excited about. This is the way you can really manage consumerism and manage that financial risk like I talked about. You know, these personal health account contribution has some advantage. They're tax deductible. You can potentially use the accumulated funds. If you have a big expense, you don't have to find the money to pay a large hospital bill. And if you don't use it, it rolls over. Even the MRAs, you can roll over $500. And all of them have tax advantages. And this, you know, we talk about Alex support tools is one way you can look at it. I'm going to talk to you a little bit about some of the tax advantages of the FSA and the HSA, but This is a simplistic look at your medical reimbursement account. I'm just going to be honest. Without the medical reimbursement account, the HSA, the FSA, excuse me, is a gross estimated annual income of $60,000, an estimated tax rate of 30%, $18,000, gives you a net annual pay of $42,000. If you have $2,600 worth of health care expenses, that your final take-home pay would be about $39,400. If you've got a MRA flexible spending account, as your $60,000, we're going to deduct the $2,600 up front. As your adjusted gross would be $57,400, and the tax rate of 30% is $17,220. That gives you final take-home pay of $40,180. You'd save $780 a year in taxes. The thing of it is, if you put $2,600 in your medical reimbursement account, that's available to you January 1. You don't have to wait till you put in. We'll talk a little bit more about that later. Your health savings account, this is the one that's paired with a high deductible health plan. You still see your $60,000 worth of gross annual income, your 30% tax rate, annual take-home pay of $42,000. This one you show $6,900 worth of estimated health care expenses. This is a family. $35,100 is your net take-home pay. If you got a health savings account, and this is up to the maximum, this is the maximum for family, $40,000. Annual health care contribution is $6,900. Your gross pay goes down to $53,100. Your estimated tax rate again is 30%, $15,930, and then your final take-home pay is $37,100, so you save $2,070. Now this is a real simplistic example. I'm just telling you. There's a lot of other things, and I'll tell you some of the interesting facts about it later. Your Alex tool can help you develop how your tax savings will work. It's really good. Let's go talk about flexible spending accounts. That's your medical reimbursement. You got two different types. You got medical reimbursement. You both have these now. These are available now. This is just an extension of what we have. And we'll talk about how they work. Your medical reimbursement account, that's for medical, dental, pharmacy, vision, health-related expenses. Accumulation, you roll over up to $500 to the next plan year. You use your WageWorks debit card. We got the debit card you can use. Your limits is a minimum of $300 per year, a maximum of $2,600 per year. And that's available in full as of January 1. Now, your dependent care account, that's if you're taking care of a child under 12, or you have certain adult daycare that you can count if you claim an adult as a dependent. Okay? There's no carryover allowed on that one. Ease of use, you have to submit a claim online for reimbursement, or you can have them pay your daycare provider directly. It's $3,000 up to $5,000, and you can only make claims up to what you've accrued in the account so far. Then we go to some of the new things we've got. The health reimbursement has been around with the CDHP, but your HSA is the new one. It's with the qualified high deductible health plan. Your CDHP 2000 has a $1,000 a year contribution from your plan sponsor for a participant, $2,000 for the family. The C3000 is $250 and $500. Your HSA and your H1500 is $750 per participant, $1,500 for family, $500 for participant in H2000 and $1,000 for family. And then the H3000, you can do it, but it has to be your personal contribution only. On the $1,500 and $2,000, you can contribute up to the maximum of the IRS with the personal combination of what the plan sponsor puts in and you put in. Wasn't that simple? Yeah. I'll talk to you a little bit about how these two are alike. They both pay medical, dental, behavioral, and health and dental and vision expenses. They both, your unused balance rolls over with no limit on how much you can roll over. They both use that debit card. We'll talk about that more in the next little bit also. Some of the differences, your HRA is only for your CDHP, both the C2000, C3000. I know it says B1000 on the slide, but we don't have an excess accumulation, so it's not available. You cannot make any participant personal contributions to an HRA. It does not earn interest, and there are no fees. On the HSA, each plan sponsor puts in, I told you which one, on the $1,500 and the $2,000. You can contribute pre-tax dollars through the payroll deduction or post-tax, whichever you want, and claim it on your tax return. Your earnings depend on your fund and account chosen. And account assets can be gained at tax-deferred interest. The investment earnings based on your account or fund you select. There's a $1,000 minimum balance required to invest into their money market type accounts. And that's interesting because if it's in the money market, it takes a week to get them out of the money market to make a claim on it, but it works. And also there's a $2 a month fee for low balance accounts, which are considered less than $5,000, and it's deducted from your balance. Those funds, I know that the HSA's funds are located in Mellon Bank. I don't know, HRA's in there too? Oh, no, but just HSA's are located in Mellon Bank of New York. Okay, some other differences is the funding differences. Of course, the HRA, you can only have funding from the plan sponsor funding. It's available at the beginning of the year. There's no annual limit, and if your Medicare enrollment in A or B, funding continues. Now, in your HSA, plan sponsor, if it's in the plan that you choose, the H1500 and the H2000, that's available at the beginning of the year. What you personally contribute is available monthly, okay? Now, you can contribute up to both the plan sponsor contribution, and you can go up to the maximum of the IRS limit. Self-only is $3,450. For family, it's $6,900. But if you're 55 years or older, you can contribute another $1,000 annually, which would be $4,450 for self-only or $7,900 for family. Okay. Now, if your Medicare enrollment, here's one of the quirks. If you enroll in Part A or B Medicare, if you get 65, all new funding stops in an HSA. But you can use your balance to pay premiums at that point. If you're family and your family member, like if you're participant plus one, and your family member is over 65 and enrolled in Medicare, either Part A and B or just A, you can't go, you'd be subject to the $34 or $44.50 limit as opposed to the higher family limit, okay? If you've got a health reimbursement account, you can have a medical reimbursement account. They're compatible. You can use it for any of the medical, dental, vision, health, behavioral health, pharmacy, whatever. However, if you're in an HSA, and we're going to talk more about this, and you have a medical reimbursement account, you can only use it for dental and vision expenses until called a limited use until the IRS defined deductible is met. Now the IRS defined deductible is $1,350 for single and $2,700 for family. But and what you do, once you meet that, then you can go and call WageWorks, and they'll transfer it over to a full use account. And this is kind of what I'm talking about. You see, your MRA, you put $2,600, but you can only use it for dental and vision until such time as you meet your medical expenses or your all expenses either meet those IRS deductibles of $1,350 and $200, and then it converts to a full use account, and you can use it just like any other medical reimbursement account. And then my friend Peter Hang, wasn't it, came up with this great way of illustrating this, and I think it's really neat. It's called the water fountain stacking. As you have a flexible spending account, which is your medical reimbursement account, and you've got an HRA, this is the way it works. When you start to file a claim, which is just like taking water out of the water fountain, it's going to drain out of your medical reimbursement account first. And why would you think that? Because an MRA, as you use it during the year, you've got it or you lose it, except for $500. So that's why you use the FSA first and then your HRA. Because HRA you can carry over with no limits. However, it's getting a little more complicated with the HSA. This on the left is you've got your MRA. The FSA there is your medical reimbursement account, and then the HSA to the right of that is, and you can only use that for dental and vision initially, and then your medical, pharmacy, and behavioral health expenses come out of your HSA until you meet that deductible, either the $1,350 or the $2,700, and then all of it is grouped together and it takes it out of your medical reimbursement flexible spending account first and then the HSA. But you have to call WageWorks to let them know you've met that deductible to make the transition. I'm sure you have to provide some sort of documentation, but nobody explained that to me. Okay, so here we go again, and this is the same thing. You can actually have some leftover HRA. See, it gets really complicated if you're moving from a consumer-driven health plan, which your dental and vision would come out of your FSA, your HRA, and then your HSA until you meet that deductible, and then it'll stack as medical reimbursement account, HRA, and the reason it does in the medical reimbursement account is use or lose. Your HRA, if you exit in certain circumstances, that doesn't carry over with you, but your ASA is yours, no matter how you exit the plan, the termination or retirement. Here's the thing: carry over at the year end, your medical reimbursement account, that's on your right. You can only carry over $500. Your HSA directly to its left, you carry over whatever balance with no limit. Your HRA, you carry over as long as you remain in HealthFlex and through retirement. If you retire, your medical reimbursement account has to be submitted within 90 days for services prior to the date of retirement. Your HSA, unused balance remains yours indefinitely. Your HRA unused balance remains until it's exhausted. However, if you terminate from UMC employment or waive from HealthFlex, the health reimbursement account, you got 90 days to submit for services prior to termination. Unused balance is yours indefinitely, and your HRA is your unused balance is your 90 days and then forfeited. I don't know if one of the things I see is, there's a lot of difference between the bronze plan and the B1000. One thing you might want to consider, and this is just food for thought, is if you want to go bronze, take the savings between that and the B1000 and put it into HSA. Or any of the ones in between, put the difference between that into an HSA to help you develop an account to help you offset and help you manage that financial risk. That's what this whole thing is about, is managing financial risk. So I think that's something for you to think about. Like I said, I don't expect you to leave here and know exactly what you want to do next year, but I do want to talk to you about this is the way you can kind of configure and calculate what you do need. The next thing we're going to talk about is the decision support. Like I said, y'all ready to make your decisions now? I don't expect you to be. I don't expect you to be. I hope you're not. I hope you're thinking about it. Because this is what we're going to give you some tools in the toolbox to be able to help you make the decision. And here's the tools we're going to give you. And I'll start off with a little video on those tools that you'll have and some of the details of the resources that the Health Flex Exchange provides you to choose that right plan for you. Okay?
Through Health Flex Exchange, you'll shop for a health plan like you shop for other goods and services. Compare options, compare pricing, compare features. Then select the plan or plans that best fit your needs. Consider your budget and how you would handle unplanned medical expenses. Would you rather pay higher premiums each month, but less out of pocket if you have a big expense, like an emergency room visit or hospital stay? Or do you prefer to pay lower premiums each month, knowing that you will pay more out of pocket when you use healthcare services or if something unexpected happens? Consider the number of dependents you'll cover in the plan. Will your defined contribution vary based on how many people you cover? Think about your medical needs. Do you or your family members see doctors often or take many prescriptions? Do you anticipate any hospital stays or surgeries in the coming year? These factors are important when evaluating your Health Flex Exchange options. We know this is a lot of information to think about when trying to choose a plan. So Health Flex Exchange offers decision support resources to help you evaluate options and choose the best plan for your needs. You can find these no-cost consumer tools on the HealthFlex WebMD website. Any information you enter here is confidential. You can log in 24/7 to use decision support tools as often as you like. Beginning in early fall, meet Alex, the virtual benefits counselor. Alex will walk you through Health Flex Exchange plan options and explain how your defined contribution works long before you actually have to choose a plan. Use Alex to learn more about each plan and to compare different plans side by side so you can make an informed decision when electing your plan. Alex can help with your medical, dental, and vision plan choices. You can also use the My Choice tool online or by phone during the annual election process in November. My Choice considers costs as well as your financial safety net and preferences when guiding you toward a plan. These decision support tools walk you through plan cost scenarios based on your preferences and what benefits you think you'll use next year. The tools can help you understand how your total out-of-pocket costs can vary under each plan and can guide you to which plans may be the best match for you. The out-of-pocket costs shown by Alex and My Choice are just estimates and not a guarantee of pricing, but the information provides a good idea of how the different plans might impact your budget. If you aren't comfortable using the online tools or still have questions after using Alex and My Choice, you can speak with a Business Solver representative during annual election for help.
There's several considerations you need to think about when you're making your choice, when you're shopping for coverage. I guess that's a better way to say it. Your family size, your spouse or your children, you're going to cover them, yes or no? I gave you the sheet to show you how much defined contribution you're going to have based on who you covered. Your premiums based on the number of dependents. Health status, expected use. You've heard that before. Emergency or unexplained procedures. Any plan costs. You know, somebody says, well, how can you plan healthcare costs? Well, early in your life, when you can plan, sometimes you plan when you're going to have children, or sometimes you don't plan when you're going to have children. They just surprise you. That's the way it worked with us. And then you plan, you've got retiree premiums in the future, whether you want to save for that. Your financial risk tolerance is there, preparedness. You determine whether higher premiums and lower costs later is right for you, or lower premiums and greater soft cost sharing is right for you. It gives you the opportunity to choose. What's your budget like? What your medical needs are like? That's what you need. Some of the tools we gave you, they mentioned in the video, Alex. Alex, well, my wife finally just made me quit going to Alex at home because I kind of enjoyed playing with it, because you go and it asks you questions. First question it asks you, it says, is your sound on? And if it says, if it is, hit yes, and you hit yes, and it, and it goes on. And it says, it asks you some questions, but like it even asks you some that's kind of, and if you don't want to answer them, you don't have to answer. But it does. If you answer them all, it helps you. One question that I never answered is ask you to put your email address in there. And I said, well, they're going to send me emails if I do that. Well, they don't. It's really, the only reason they ask you for that, if you ever go back, it'll put you right back where you left off if you enter your email address again. They don't send you anything. And all of this is confidential. I just want to tell you that. I was shocked, and I guess I am naive, when I started going to CBO conferences, and so many conference benefits officers used to talk about how paranoid their clergy were about their health status and whether the conference finds out about it. In fact, I even have clergy call me and say, well, I guess you know that my wife's been in the hospital because you get the claims. I said, well, no, I don't get the claims. I don't know individual claims. I get claims on aggregate data on a quarterly basis of how much the plan is spending, not on individuals. And we're really not concerned with that. And we don't give health care. And I used to have, there was a clergy couple in the upper part of the state. They're both retired now, and it used to refuse to fill out the health quotient because they said they thought they didn't want the cabinet to know things about their health. And I said, well, they don't. Well, they didn't believe that. But the cabinet doesn't get anything. I don't get anything. The only thing I get from the health quotient is how many people's completed it and who hasn't completed. And that's all the individual information we get. So know that your information is protected there. So feel free to use that tool for you. The Alex Counselor has been available since since closer to the 1st of September. My Choice will be available in our annual enrollment period. In fact, I got a call this morning. Somebody said, I can't get into My Choice. And this is somebody that has not gone to any of these workshops yet, but that's not going to be available until annual enrollment. Annual enrollment is November 1 through November 16. November 1 through November 16. Your Alex tool is available now. Remember, when you use your Alex tool, which is a great tool, it's in plain English. It gives you suggestions based on the information you give it, and it tells you about a lot of tax savings opportunity. It's best for comparing the plans. It's best for estimating your health care costs for the year, and it gets you an early start. It does not make your decision for you. And completing that doesn't complete annual enrollment. Annual enrollment is going to be available through My Choice, November 1 through 16. It goes through the same kind of thing, but it's more of a spreadsheet. It's not as intuitive as the Alex Counselor. And then it's integrated right into the annual enrollment process. It's best for cost comparison and savings, and it also gives you the opportunity to make your decisions. Okay? All right, here's how you do it, folks. Go to westpath.org. You look at HealthFlex WebMD, then you log in. Everybody knows how to log in. If you don't have your username and password, call HealthFlex, call WestPath, 1-800-851-2201, and they will send you a PIN. They mail it to you. 1-800-851-2201. They will mail you a PIN, and you can set up your username and password. And then that'll get you to where you can get Alex or My Choice after November 1, and all other tools, your annual election portable, your consumer education, details and FAQ, and the vendor links. And also, that's where somebody went and looked at somebody said they went and looked to see how much it costs, what the office visit cost was, and it wouldn't let her because you hadn't done your HQ. So that's kind of interesting. I didn't know that, but that's. So here's what we got. If you get on, after you log in, you'll get this screen. On the second line there, all the way to your right, you'll see that that's how you get to Alex, your HealthFlex news. That's the guy that the benefits counselor, and you go through it. All the way on your left is your consumer tools. That's where you can find those decision-making things that we talked about earlier. Alex is open now. I think does a real good job at explaining the confusing concepts and benefits in real simple, non-technical language. The graphics are great. The graphics are loud animation, and it's got humor. It's just really good. Average time takes 10 minutes. Really, I think to study it, it'd probably take you about 30 minutes to complete it. It even gives you personalized recommendation, and everything's in plain English, and these are the modules on it: medical, pharmacy, dental, vision, and defined contribution, and tax savings, and employee assistance program. I'll tell you how to access it. It's confidential, and if you put an email address, that just saves your link to get back to it where you left off. It'll suggest a plan. It'll say, it crunches the numbers. It's really neat. If you watch it, you hit, it says, let me crunch the numbers, and you hear this crunching noise and something going around and then it calculates the premium, the DC, and estimated out of pocket. And it does a side-by-side comparison. And it gives you the plan to minimize your out-of-pocket costs or maximize. And that's what it does. It gives you some choices, and then but whatever they suggest, the decision is yours to make the plan, whatever plan you want. It talks to you about the health reimbursement account, the health savings account, the flexible spending account, the medical reimbursement, and all that. It'll talk to you about all that when you go through it. And it'll give you some estimated on tax savings. When it gets time for annual enrollment or process, My Choice is available. You can go online and make your choice. It does comparisons, family size and stuff like that. It asks a few questions and gives you a low cost. And you can make your choice that way. Or you can go, you can call Business Solver telephone support. And they're available Monday through Friday, 8 a.m. to 8 p.m. I know it says 7 to 7, but that's Central Standard Time. One of my concerns was this from the old Medco days was where is this call center located? Because if you remember the old Medco days, most of your calls went to an offshore call center, and you usually had we had a lot of complaints about people not being able to understand. These folks know our plan. They're in Idaho. I don't know if that'll help with language barrier or not, but they are in Idaho. And so that it is not an offshore call center. Everything you talk to them is just as confidential. And they're available starting November 1. One thing I want to tell you is if you fail to make an annual election the conference has chosen that you will default to the CDHPC 2000. That's not our recommendation for you. That's just, we had to pick a plan to follow. We knew that was a good plan. We have people who have operated under that plan successfully for years, and we decided that would be the best plan we wanted to put people to. The CDHPC 2000. That's the second goal plan. That's what you're defaulting to if you don't make a choice. Some of your other decision support tools you got is under Blue Cross Blue Shield, Optimum RX, you get provider finder, treatment cost estimator, that's in there. Pharmacy cost estimator, you can check the estimated cost of your drugs, and it also has a bunch of information, and also has another link to Alex there. It also has more details about the different brochures of the plans and guides to understanding the different accounts. And it does have a frequently asked questions section. Okay, and you also have a detailed reference center. That's got your summary plan descriptions, medical, behavioral health, dental booklets, summary benefits, and reimbursement account information, and the notice of privacy practices. I have to tell you this. Somebody came to my workshop last Tuesday. I did one Tuesday and Thursday. And all day Wednesday, I got requests for summary plan descriptions. And then on Thursday, when I was trying to answer, she sent me an email saying, "Oh, I found them. That's where they were." So, they are there for you. Anybody got any question about the support tools, decision support tools that we're going to provide you? Okay, well, the next section, we're moving to the final section, folks. This has been the longest one so far, about how to make your annual election decisions, and this one will be annual election.
During annual election, you'll enroll in a HealthFlex plan online through the HealthFlex WebMD website. Start at westpath.org. Select Account Login at the top, or HealthFlex WebMD at the bottom. Log in to reach your personalized WebMD homepage. From here, you can access Alex, Virtual Benefits Counselor, directly on the HealthFlex WebMD site. Click on HealthFlex Plan Benefits or the Annual Election link to begin your elections and use the My Choice tool. As you compare HealthFlex plans, consider your health needs, financial situation, family size, your ability and comfort handling unplanned medical expenses, and the amount your conference or employer provides as a defined contribution. Think about whether you prefer a health reimbursement account or a health savings account to help pay for current medical expenses and save for future medical expenses. Use Alex and My Choice to model different cost and benefit scenarios and further compare plan options. While online, you'll first be able to view the medical and pharmacy plan options and each plan's prices. In fact, you'll see the full cost of plan premiums and how the cost is offset by your defined contribution. It's more cost detail than you've seen before and can help your decision-making process. When you're ready, select the plan that best suits your situation. Remember, your annual conference or employer will fund a fixed amount defined contribution that covers part or all of your cost for plan premiums, depending on which HealthFlex plan you choose. Once you select a plan, your defined contribution amount from the conference or employer is credited to your plan purchase. Keep in mind the examples with Pastors John and Judy. If your defined contribution is lower than your plan cost, you'll have to pay the difference through pre-tax salary deductions. If it's higher than your plan cost, the extra defined contribution amount will be added to your health reimbursement account or health savings account. View your dental and vision plan options and prices, then make your selections. You must cover the same people for dental and vision benefits that you cover for medical and pharmacy. Your defined contribution can help pay for dental and vision premiums too. If you'd like to contribute to a flexible spending account or health savings account for next year, annual election is also the time to make those elections. After you pick your HealthFlex plan, you will see prompts for optional FSA elections. And if you select the high-deductible health plan, you will also see a prompt for optional pre-tax contributions to your HSA. For the HSA election, be sure to accept the HSA terms and conditions when prompted. Approve your selections and print a copy for your records before you sign out. If you need help making your plan elections, contact Business Solver for support. Be sure to read the brochure and other materials provided by your plan sponsor and the Center for Health for more details about HealthFlex Exchange. At a time when health benefits are changing across the U.S., HealthFlex Exchange is designed to give you more. More HealthFlex plan choices, more flexibility to select the plan that fits your needs, and more control over how to use your healthcare dollars. Combined with the broad provider networks, high-quality wellness programs, and multitude of resources that have always been part of HealthFlex.
Okay, just real quickly, annual enrollment is November 1 through 16. Use those decision support tools to compare plans. Use your defined benefit contribution to shop for your plan. Choose from that great choices we have, that suite of medical, dental, and vision plans you have available. Elect flexible spending accounts or health reimbursement account or HSA contributions. If you don't make that election, you're going to be defaulted to the C2000 with no dental, an exam-only vision with no HSA or MRA contribution. Our goal has been, and that's the reason I'm having so many of these meetings, is to not have any defaults. I know that's a lofty goal, but that's what I would like to have. I want everyone to make a decision. And you know, basically one of the reasons that, here's our timeline. You know, you probably already had mailings from HealthFlex. The Alex Counselor is available now. You're going to get some more stuff starting next month about the support you have, and then November you got to make your choice, and then in December we give you the ID cards, and then the January the new benefits go live. This exchange, a lot of people say, well, you know, what was wrong with what we had? This is my opinion, is probably 90% of our covered people are overinsured. People get comfortable with what they're doing. The way we can help provide group coverage in this ever-changing or dynamic environment is to take a little responsibility ourselves. If you can manage going to a lower cost alternative, it's going to help everybody, including yourself, in the long term. Support cost sustainability, and you can manage your year-to-year cost increases. This is the way we can do it. Benefits to you is you have best fit what meets your needs. You can use what we're providing as a defined contribution in the most meaningful way, and we're using the support tools that you have to do it. And really, that's all I'm going to cover with you today. Anything else? Thank you for coming. I appreciate it, and y'all have a safe drive.